Well, the Public Health Agency of Canada says the Pan American Health Organization revoked our country's measles elimination status after confirming that the same strain of measles has been passing from person to person for more than a year.
It is disappointing to hear that we've lost our measles elimination status. Having said that, it's an indicator that we need to really double down on our efforts to get this under control.
Canada's outbreak began in New Brunswick in October 2024 and spread to more than 5,000 people in the country, among them 2 infants in Ontario and Alberta who were infected in the womb and died after they were born. Ontario declared an end to its outbreak just last month after more than 2,000 cases in the province, but Alberta's outbreak continues, with nearly 2,000 infected so far. BC, Manitoba, Quebec, Nova Scotia, and PEI have also had cases. So has the Northwest Territories.
The vaccine against measles is one of the most effective and most widely studied vaccines in all of medicine. We know it works really well, but of course, it only works if you take it. And we've had a drop in the number of Canadians, importantly in certain pockets of the country as well, who are unvaccinated. And that is the perfect environment for a virus like this to spread.
Experts say vaccine hesitancy is being fueled by misinformation, distrust in public health authorities, and lingering COVID-19 disruptions. But infectious disease specialists say one of the most important parts will be targeting unvaccinated pockets of the country.
When the virus, which is extremely contagious, enters those regions, it takes off like wildfire, which is exactly what happened in southwestern Ontario and in parts of Alberta. It's really now enabling local public health units to identify these areas, work with local communities, lower barriers to vaccinations, improve access to primary care.
In order to earn the status back, Canada would have to squash the current strain of the virus for at least 12 months. Venezuela and Brazil were recently able to do that, though it took them about 5 years.
Is that how long it's going to take Canada to earn it back?
I think it depends. It depends on how seriously we take it.
In a statement, a spokesperson for the federal health minister said in part, Minister Michelle is following the situation closely and working with Public Health Agency of Canada as well as her provincial and territorial counterparts so Canada can re-establish its measles elimination status. The spokesperson also added that health ministers across the country were briefed on the status of measles during their meeting in Calgary last month. Measles is one of the most contagious diseases in the world and requires 95% vaccination coverage to reach herd immunity.